When we talk about non-surgical rhinoplasty, it's basically filler agents in the nose. So there are several recommendations we need to give patients. First, it has to be an approved filler. Ideally, there's 2 or 3 hyaluronic acid basically is what's being used all around the world as the main filler in the nose. Sometimes people use other products that are not necessarily the ideal products to use in the nose. And one really has to be careful where you inject, because if not, the complications can be disastrous. So everybody can be a candidate. What I feel in my hands is that I use it only for minor things. I don't think a filler or a non-surgical rhinoplasty is a replacement for a rhinoplasty.
The right candidate for the non-surgical rhinoplasty can be everybody, but not everybody have the chance to go through a non-surgical, because sometimes there are scarring on the nose and there are asymmetries, nasal asymmetries and functional impairments which cannot be treated only with the injectables. So you have to be aware to inform the patient that we are not treating them for the functional problem, but we can treat them only for the aesthetic problem. And as well as we can make an accurate analysis, only people with small humps or small voids and the big nasal dorsum defects are the good ideal candidates. The other ones can have maybe very small residual deformities from a primary rhinoplasty can be treated. All the other defects are much more difficult to be treated.
The patients who are good candidates, in my opinion, are the patients who you as a surgeon has treated in the past. Possibly it's your own rhinoplasty, has 1 or 2 minor irregularities where you think the surgical outcome is not going to be any different as opposed to going for a filler sort of rhinoplasty. And I think, in my opinion, that is probably an ideal candidate. Having said that, there are very occasional patients who may have major health issues but do want to improve their nasal appearance. That can help them actually in day-to-day life. So when analyze and assess properly, those sort of patients are certainly good patients. So it's patients who have minor irregularities where surgery may or may not address all their problems are probably the best ones.
A non-surgical rhinoplasty, I think now is a hot topic and attractive topic for many patients. But honestly, it doesn't mean such as a good result without any surgery. There are some specific indications to perform rhinoplasty without surgery or non-surgical rhinoplasty. For example, in the lateral or profile view, if there is a deep groove here in the radix area, we tell here the radix area. If there is high groove here, we can fill it with some fillers, and it will be just better show in the lateral view. But it is temporary and it is not permanent. And for some of the cases, we put some Botox just when there is a hyperactive muscle that moves the tip of the nose downward during speaking, during laughing. So there are very specific indications to perform non-surgical rhinoplasty.